Hello friends and welcome to YouTube channel HealthQ, the place where our mission is to motivate you and help you to move on to the brighter side of the health. This video is going to be quite informative for you if you are someone who wants to understand how we can help you with your facial paralysis, Bell's palsy or synkinesis. What you should expect in the first consultation that you take with us. You who are someone who is dealing with facial asymmetry due to Bell's palsy, synkinesis, temporomandibular joint dysfunction, a facial paralysis due to stroke, hemifacial spasm, or even a postural deviation that leads to facial asymmetry, or any condition, a neuromuscular disorder that's related to your head, neck, and face, then we are that organization that can help you out through online physiotherapy medium. Let me walk you exactly what to expect in your first consultation. Hi friends, I am Dr. Meghna Dave. I'm a neuro-rehabilitation physiotherapist with 15 plus years of experience in helping patients with neuromuscular disorders that's related to head, neck and face through online rehabilitation modality. Whether you are in the early stage of Bell's palsy or you have developed synkinesis, you have facial pain due to other issues like TM joint disorder or hemifacial spasms. Online rehabilitation is not just possible, but it can drastically help you to work on your recovery and rehabilitation at comfort of your home. It's highly effective when done right. Let me tell you what happens in the first consultation. First, when you reach out to us, you have to schedule a session or consultation call with us. This call happens on an encrypted platform like Zoom or else Google. With this consultation, we start by understanding your key concerns. We take your detailed history. We try to understand your symptoms. When it started, what were some other previous disorders that were there for you? And what are the treatments that you have taken so far? We try to capture as much information about your condition as much as we can. We'll guide you through a series of movement-based assessments that can be easily done over a video call. That can be easily done. This assessment is basically to identify the level of facial asymmetry. This assessment is basically to identify the level of facial asymmetry, at the same time the functional capability of the facial muscles. Symptoms we also try to understand and evaluate the functional capability of the facial muscles. How severe or how mild it is. At the same time, what type of synkinesis we also try to understand and evaluate. That's not all. We do a jaw and TMJ how severe as well, or how mild it is. At the same time, what alignment, clicking and pain through simple movements, functional actions. At the same time, we also see what are the associated symptoms due to TM joint issue. In synkinesis evaluation, we try to understand the severity of the synkinesis. At the same time, the type of synkinesis you have got using some gold standard methods of evaluation. We check for jaw alignment. We request you to submit some pictures of yours clicking in order to do through simple evaluation and facial symmetry evaluation. For stroke at the same time, we also see what are the associated symptoms due to TM such as speech, sound production difficulties, facial reflexes, expression control. We try to understand the severity of the synkinesis. Post-evaluation, we will exactly tell you what is your condition, using some what are the key impairments of evaluation. Focus or prioritize first, what secondary impairments that are associated with the same time, and how to work on it. At the same time, we curate and we request you to submit some pictures of yours in order to do a rehabilitation plan or in order to do for you evaluation that is depending on your situation or your facial symmetry evaluation. To explain you clear do's and don'ts that you should keep in mind and follow and throughout the process so that you don't worsen your condition. We also at the same time we also suggest you speech, milestone and timeline to look out for production difficulties, work on recovering or rehabilitating facial reflexes. Muscles. Keep it simple. These sessions are very simple, and to keep it simple, sensory motor coordination. A good internet connection, a phone or else a laptop, a background which is well lit, post-evaluation which is not exactly tell you in order to get this online consultation done for yourself. That you should focus on prioritize first that people ask often to us. What are the secondary impairments that are associated with it online physiotherapy? And how to work on it? The answer to this is absolutely yes. Now, majority of online questions that people ask, especially for facial rehabilitation, are active assisted sessions. Number one, then we can guide and personalize through online physiotherapy. Therapist guide you through the process, absolutely yes. Majority of the personalized rehabilitation for facial rehabilitation are active assisted sessions on your situation or your condition. Ensure where the live session are completely one-on-one through the process. There is no third person gets involved in this session. and do the practices in the right way. We use encrypted platform like
we also
Google Meet
explain
and
you
Zoom.
clear
So
do's and
the
don'ts
security
that you should keep in mind
these
and
sessions
follow
can ensure that
throughout
your
the
privacy
process.
is maintained.
Yes,
What
absolutely.
about the electrical currents that I need to take in your condition are completely one-on-one. According to us, we don't recommend electrical stimulation in majority of cases. At the same time, in certain cases where there would be milestone we will upfront tell you and you might have to so that purchase a device or else go to a nearest center to get your electrical stimulation done. To keep it simple, what about the electrical currents in majority of cases and electrical stimulation are very simple and to keep it simple, you just need a good internet connection. But at the same time, we would highly recommend to submit certain cases where there would be need that you will not upfront tell you and you might have to have online purchase a device or else go to a nearest center. It will be very helpful for us if you share electrical stimulation to us so that we can help you. But to guide in the better way. Majority of cases that people ask stimulation will not be required. People ask us. If you who are someone who is either suffering from Bell's palsy through online physiotherapy or stroke-related facial disorders, our organization is majority of online physiotherapy sessions through virtual rehab. We would highly recommend our active assisted sessions to where that you have contact details are mentioned in the live session or at the same time comment section. It will be very helpful for us if you share those information in the right way so that we can help you to guide in the better way. Are these sessions private and secure? These were some common questions that usually people ask us. We ensure if you that the session who is either suffering from Bell's palsy, there is no third person gets involved in the session. Facial disorders, at the same time, our organization is well experienced and Google to help you out through virtual rehabilitation. The security of your so what are you waiting for? We can ensure that your privacy is maintained. The contact details are mentioned in the description box. At the same time, comment section. What about the electrical currents that I need to take for my therapy? Well, according to us, we on that note, we don't recommend electrical stimulation in majority of cases, and we'll see you there. In certain cases where there will see you in another video, we will upfront tell you, and you might have to either purchase a device or else go to a nearest center to get your electrical stimulation done. But I'll again tell this: in majority of cases, an electrical stimulation will not be required. Do I need prescription? Well, not actually, but at the same time, we would highly recommend to submit all the medical information that you have got, your doctor prescription, whatever you have got that's related to your condition. It will be very helpful for us if you share those information to us so that we can help you to guide in the better way. So, these were some common questions that usually people ask us. If you who are someone who is either suffering from Bell's palsy, synkinesis or stroke-related facial disorders, our organization is well experienced and equipped to help you out through virtual rehabilitation. So what are you waiting for? Reach out to us to know more. The contact details are mentioned in the description box, at the same time comment section. On that note, let's end this video here and we'll see you there. And we will see you in another video. Thank you.